By 7 a.m., when Sitara Begum arrived at this oxygen plant in Delhi, there were already 70 people in front of her. Each one as desperate for oxygen as the next.
आप आगे चली जाओ लेडीज को भेज रहे हैं एक करके वो लेडीज ज्यादा है भी नहीं आप अकेले आप चली जाओ ठीक है ना
While Sitara tries to work her way through the crowd and the bureaucracy, her father-in-law is at home. His oxygen levels are dropping fast.
आप कोई डॉक्टर की पर्ची लाई हो हाँ हाँ नहीं ऐसे नहीं तो देखो जी सब खड़े हुए हैं आपके पीछे सभी है ऐसे
चेरी वाले ने बोल रखा कि आप भैया वो हैंगे वो उन्होंने बोल रखा कि आप ले जाओ लेडीज.
The family had managed to get him a cylinder, but when they got it home, they discovered it was empty. So now she's here trying to get it filled, hoping, like millions of other Indians, that she will be one of the lucky ones. Last year, the government raised funds for over 160 new oxygen plants. But months went by before they started construction. So far, only 33 have been built, resulting in queues like this. As Indians rely on a creaking transportation system to get what oxygen there is around the country.
In New Delhi, the oxygen shortage continues. We're outside an oxygen plant, and people have been lining up here all night, as they do almost every night for the last 2 weeks. Now, every once in a while, they allow 10 or more people to go in to refill these cylinders. But on the whole, they are prioritizing hospitals before individuals.
By the time we leave, Sitara's family has secured enough oxygen for the next few hours. She has to go home to look after her family now, but will be back tomorrow. Balbir Singh's son died of COVID at just 27. And now, somehow, he has to find a way to care for his grandson, who's 4 months old.
किसी ने कुछ नहीं करा ताले लगा रखे हैं सबने बुरा हाल कर रखा है एकदम मेरे बच्चे ने मेरे हाथ में तो जोड़ा तड़प के एक ऑक्सीजन के पीछे खाली जवान बच्चा है मेरा भी.
With no space in hospitals and limited oxygen, even if you can get a bed, Delhi's crematoria are filling up. Jitendra Singh Shanti normally performs 10 cremations a day. Today, he estimates it was 110. Shanti's wife and daughter have already tested positive for COVID, but he keeps performing the last rites for others and worries that the collective trauma will never heal.
ये इंसान नहीं मर रहे, ये इंसानियत ही मर रही है दिल्ली के अंदर. एम्बुलेंस जो 1000 रुपए की मिलती थी 20,000 25,000 में नहीं मिल रही. सड़कों पे मर रहे हैं लोग, कारों में मेरे लाशें कारों में आ रही हैं, 3-wheeler में आ रही हैं.
Today, what was left of India's vaccine program crumbled. Mumbai has been forced to say it will give no more vaccinations for at least 3 days. Elsewhere in India, state after state has announced that tomorrow's planned rollout to all adults cannot go ahead, as they simply do not have the vaccines.
Well, earlier I spoke to Jyoti Yadav, a journalist with The Print in India. She's been travelling to remote rural areas in Uttar Pradesh to report on how bad the COVID crisis is outside the big cities like New Delhi. I began by asking her whether the people that she's been meeting with COVID are being included in the official figures.
Not exactly, because there is poor health infrastructure in our villages. One has to travel 40 kilometers to reach a primary health center to get oneself tested. Many of these families don't have that basic financial, support, so that one person goes 40 kilometers away to get himself tested. Secondly, our district administration, which is overworked and burdened now, they don't have enough sampling kits for the rural belt right now. And things are really, really bad in the rural belt.
What about shortages of oxygen that we saw, being very acute in places like Delhi? Is the same thing happening in rural India, in Uttar Pradesh?
Yes. So today I went to the Ghazipur district. It is in the eastern part of Uttar Pradesh. and there in emergency ward there were 20 patients. All of them were all of them needed oxygen, but there was a shortage, so there was one cylinder and 3 patients were attached to it. Some of them were as young as me, 26-year-old, some of them were 80-year-old. So more and more numbers, more and more critical patients in the dire need of oxygen are coming to the district hospitals, but there is no oxygen. Sometimes I have seen people dying in front of me because they did not get oxygen in the rural side, in the districts.
And who are people blaming for all this?
They are emotionally exhausted. They are complaining, but not in the visible form. They are emotionally exhausted, and they are not even they don't know whom to talk, who to hold accountable. Right now there is utter chaos in on the ground.
Now, we know that Uttar Pradesh delayed its elections from December to now, to April. They've just held them. And obviously there were lots of big rallies. Do people think that that's what might have increased the infections? Definitely. I have done 3 stories. The panchayat polls, it forced people to come from other states. They traveled to their home districts. They brought corona to the villages. There was no testing, there was no screening, there was no tracing in the early weeks of April. Have people ever seen a situation like this in the villages of India? No. How they describe it, they have heard about plague, when people, villages were wiped out. So they are in absolute panic. They are panicking. Jyoti Yadav, thank you very much indeed for that. Good luck. Thank you.